is a true honor to be here with you today. My name is Jennifer Walthall. I currently serve as the Deputy Health Commissioner of the Indiana State Department of Health, a post in which I have been honored to serve since November of 2014. We've had a little bit going on in the last 2 years in the state of Indiana. I am also a practicing pediatric emergency physician. More importantly, I am a mother of 2 incredible boys. This trifecta of roles makes today's conversation and the conversation of the next 2 days incredibly meaningful and instilled with a sense of urgency that has gone unchecked for too long. We have a problem. This problem is not limited to a single issue. It is rather a global state of apathy toward shifting our culture to one of health promotion and disease prevention rather than the more exciting and tangible process of dealing with emergencies. As an emergency physician, I see the consequences of this problem every day. Our conversation today and tomorrow and over the next coming years will shed light on how that culture manifests in the environmental exposures to our most vulnerable population, our children. I'd like to spend a few moments discussing the current situation in Northwest Indiana, where high lead levels in soil have served as a powerful reminder that vigilance in prevention, education, and systems sustainability are key to long-term success. Gaps abound at every level and in every sector. This is an opportunity to make lead exposure prevention a model for the culture of health we aspire to as a society. Lead poisoning is the #1 preventable disease condition in young children that can permanently damage the child's developing brain and other organ systems. Once a child is lead poisoned, the chances for academic, social, and occupational success are significantly decreased. The Indiana State Department of Health found 1,022 children with confirmed elevated blood lead levels from 2010 to 2014 alone. Based on a calculation model from Minnesota, there is a potential lifetime cost for these children of $121.7 million. Included are health care, lost wages, and additional community costs associated with the lifetime burden of lead poisoning in children. This estimate is low because not all data are captured for lead poisoning children in Indiana. In that Indiana law does not require universal testing of all Hoosier children. The only children who are required by federal law to be tested for lead poisoning are from households who receive Medicaid benefits. In today's healthcare market, many physicians do not routinely test children under 7 years of age for lead exposure, and therefore the majority of our at-risk population remains untested. In summary, only 7% of Indiana children are screened for lead. We have a problem. The U.S. Smelter and Lead Refinery, or USS Lead, site is located in East Chicago, Indiana. A copper smelter, lead refinery, and secondary lead smelter operated on site from the 1920s to 1985. Smelting operations volatilized metals including lead and arsenic. Some lead, containing dust, was wind deposited on the area soils during these operations. Blast furnace slag was stockpiled south of the plant building and spread once a year over an adjoining wetland south of the site, which is now a housing development. The primary contaminants of concern are lead and arsenic, which are present in exposed soils and subsequently tracked into area residences. The EPA listed the USS Lead site to the National Priorities List in 2009. The site includes part of the former USS Lead facility, along with nearby commercial, municipal, and residential areas. The overall site has been divided into 3 zones. The removal program is currently addressing soil and residential contamination in Zone 1, and specifically at the West Calumet housing complex. Mulch has been placed over all exposed soils in the West Calumet housing complex, and indoor sampling has been conducted in these homes, and analytical results are being validated. Teams have been mobilized to communicate directly with residents, develop temporary relocation procedures, develop cleaning procedures, and initiate outdoor sampling. This remedial program is currently collecting samples in zones 2 and 3, and the analytical results will be evaluated for other potential areas needing remediation. During the time frame of this investigation, ongoing development of the Superfund area continued, including public and private housing building, school building, daycare accreditation, and the building of assisted living facilities. In the spring of 2016, the Indiana State Department of Health was informed of federal, state, and local partnerships to remediate the soil lead contamination and also to relocate families in the areas with highest levels. With this in mind, the Indiana State Department of Health, with full support of the Governor's Office, chose to take a lead role in this multi-agency coordination team with the EPA, the City of East Chicago, the East Chicago Housing Authority, the Agency for Toxic Substances and Disease Registry, the USDA, and the Department of Housing and Urban Development. This team is truly the manifestation of how disparate content expertise can address critical activity for this work. And I hope that it will serve for a model for us as we move forward in this very, very powerful element. Our state agencies have had an incredible opportunity to make multiple improvements to this comprehensive response, specifically around social determinants of health. A one-stop shop consisting of health insurance enrollment, mental health services, developmental screening, and immunizations has now conducted on-site clinics for the last 3 months as part of this response. The Indiana State Department of Health and East Chicago Health Department are conducting blood lead screening events within the community, developing and distributing education materials about lead hazards, and tracking children with elevated blood lead levels to ensure follow-up. This effort has resulted in a significant increase in young children being tested within the West Calumet housing complex, and the children with elevated blood lead levels have been identified through this effort and are now entered into active case management. There is now a concerted effort for blood lead testing of young children in zones 2 and 3 as well that may also be at risk for lead exposure. We conduct weekly participant conference calls with federal, state, and local agencies because we know that this particular canary in the coal mine is not the end of this conversation. It's one that should be continued throughout, and this collaboration that we enjoy right now must have momentum and must have sustainability. ISDH has been collaborating with multiple novel partners in an uncommon way. Our Region 5 Great Lakes Center for Children's Environmental Health at the University of Illinois School of Public Health and the Indiana chapter of the American Academy of Pediatrics sponsor now a local learning collaborative in all of our regions so that we can train providers on having a heightened sense of urgency around lead exposure and screening for children. If you'd like to come, our first large event is February 4th in Munster, Indiana at the Center for Visual and Performing Arts, and then will be hosted online as a learning collaborative from there on. We also have public health agencies offering support to the Community Advisory Panel, known as East Chicago Undivided, and to any community organizations and citizens that are interested in addressing health concerns among our area residents. Specifically for our Medicaid partners, our Medicaid authorities are providing case management at an enhanced level for the first time for children with elevated lead levels, as well as other children and adults in East Chicago's Zone 1 housing complex. We asked them this past week for verbal reports, and I was very pleasantly surprised with what I heard regarding their efforts on the ground to find their members and provide them assistance to get screened and provide other assistance. Our Family and Social Security's Administration also has agreed to automatically renew coverage for insurance for those already on Medicaid in the affected area. They are also reviewing and will reopen Medicaid applications that were previously denied during this process. Our Indiana Lead and Healthy Homes program is actively pursuing enhancement of their ability to provide timely and comprehensive environmental assessments in those patients with elevated lead levels and make remediation recommendations. In Indiana, we are a home rule state, which means our local health officers are responsible for case management of children less than 7. Case management in these cases includes outreach and identification of children with an elevated blood lead level, child case management service planning and resource identification, confirmatory testing, retesting, and monitoring of child case management service delivery, program advocacy, and program evaluation. We hope to expand and enhance case management in Indiana and become a model for others to do the same through reimbursement through ongoing partnerships. To date, our multi-agency effort has completed nearly 2,000 lead tests. 17 children less than the age of 7 have lead levels over 5 in this area. None have required acute treatment, which is perhaps the best news of all. Policy implications for this work abound and are highlighted in East Chicago, and I hope that there are some take-home messages for you as you leave today. First of all, we found that daycare accreditation does not require lead evaluation for on-site testing, and we advocate that that be part of our national policy moving forward. We also did not have a lead advisory board in the state of Indiana to continue to look at policy work and implications for the future, and that will now be commissioned. We also needed to do internal process improvement for lead screening and reporting, both at the state level and the local level, and those efforts are ongoing and very exciting as we move forward to make the reporting process for screening and confirmation lead testing available to all. We also have set a data management dashboard for the state of Indiana and a lead rule to decrease case management thresholds for reimbursement to 5 micrograms per deciliter to meet the national standards. The problem of environmental lead exposure for Indiana's children remains very real. As a provider, I recognize the myriad of screening and counseling imperatives for practice. How might we choose to address this one? Models for enhanced screening adherence exist through multiple national organizations. Children through early school age remain at risk, and paper or e-screening is a reasonable approach and does not require the most costly personnel. Rural and more expensive dwellings are not exempt, as lead paint was the standard and was certainly used in the homes of the affluent as well. Churches, daycares, and schools are not exempt for the same reasons. Encouraging our elected and appointed officials to pursue appropriate regulation and enforcement in consumer protection, and to support a course of primary prevention and remove our youngest Hoosiers from their current role as the canary in the coal mine in our efforts to identify and ameliorate the burden of lead in our society are imperative. As we move forward in this effort, there are huge opportunities even outside the policy arena. Continued focus on research on brain effects, best practices in screening, remediation, and prevention are needed. We also must use this opportunity to promote nutritional choices in environments that contain lead threats. We have a problem, but with a host of solutions waiting to be implemented. So many strides forward have been made around lead exposure in our lifetimes, but complacency cannot be the new normal. Education, prevention, and collaborative problem solving must bring us together so that our legacy can be transformed.